Well, it's well known that the Gates Foundation supports many programs around malaria and HIV/AIDS and polio, but tobacco is quite unique at the foundation. It's a smaller program, but it has deep commitment from the leadership of the foundation, especially in Africa. We all know the global statistics that almost 6 million people worldwide are killed annually by tobacco. And if those current trends continue, tobacco will cause 8 million deaths annually by 2030. 80% of those are in developing countries. Tobacco use, as well as exposure to secondhand smoke, is associated with many diseases: lung disease, cancer, heart disease, as well as low birth weight and stillbirths, and it increases death in tuberculosis patients. This is just a few examples. We think there's an incredibly unique opportunity, like with the leaders that we have here today, to prevent the epidemic in Africa, and we want to be supportive of that leadership. Widespread agreement around the world supports the WHO's excellent work and all the civil society leaders' excellent work on the WHO Framework Convention for Tobacco Control. Some of the very important policies have already been mentioned: increasing prices through taxes, protecting people, especially the most vulnerable, from dangerous secondhand smoke, providing warning labels on packages of tobacco, and restricting tobacco advertising. This is an example of what's in this global treaty that's been signed throughout the world. The amazing thing that you've heard today about tobacco taxes is, while it saves lives, the revenue that is generated can be used for governments. It has an extra win for lives and economies. When we were told that the university was chosen by the WHO to host this center, we were absolutely thrilled. This university is a highly esteemed institution, and as evidenced today, it's got the credibility and the convening power to bring together a very broad group of stakeholders: government officials, national, regional, international tobacco control leaders, public health experts, advocates, members of the media, and that's what it's going to take. There is no doubt in our minds that with that type of coordination among all these leaders, we will be able to slow tobacco use in Africa. It also takes other donors. Governments are the most important funders, as well as the Bill and Melinda Gates Foundation. There's the Bloomberg Foundation. There's the private sector. There are more and more who are interested in funding and supporting this very important work that you're leading.